Welcome back, everybody. 14 after the hour, time for us to go behind the headlines. And today I'm looking at a piece that came from Business Week called Medical Pot. A drug maker bets on marijuana to treat diabetes, epilepsy, and more. And again, Business Week, folks. We're not talking about a medical journal or anything like that. This is where they're noticing the money that's possible here. Let me read to you from the piece. Medicinal marijuana advocates contend that smoking pot helps relieve pain and alleviate nausea. British drug company GW Pharmaceuticals is betting that medicine made from cannabis can also treat maladies as diverse as diabetes, colitis, and epilepsy. GW is the only pharma group in the world now selling a prescription medicine derived from marijuana plants as opposed to synthetic equivalents. The drug, a spray called Sativex, has been approved by regulators in 8 countries, Italy most recently, to treat spasms associated with multiple sclerosis. A request for U.S. Food and Drug Administration approval is also pending. The company this year plans to launch second-stage clinical trials of a cannabis-based drug that has showed promise in treating type 2 diabetes. GW Pharma, with $52.2 million in annual sales, is literally betting the farm on cannabis. Its entire drug pipeline is derived from pot that it grows at an undisclosed location in southeastern England. Diabetes, though, is just one of many diseases GW is taking an aim at. It's developing a pot-based medication to treat inflammation in ulcerative colitis and is working with Otsuka Pharmaceutical of Japan on a drug that can treat epilepsy. The company also is carrying out further studies on the MS drug Sativex that could lead to its use in treating pain for cancer patients. Now, the development of these drugs is not the problem necessarily. There are so many things that we might be able to develop from the cannabis plant that could be beneficial to humankind that, that's not my problem with this story. The problem with this story is that GW Pharmaceuticals and corporations that are going to be involved with this, like GW Pharmaceuticals, want to make sure that cannabis is guided into their profit, right? That cannabis becomes something they can profit from. And that provides an incentive for these companies and the people that support them and the people that have investment in them to be against medical cannabis laws. If I can get whole plant cannabis and juice it myself or vaporize it myself in order to treat my epilepsy or my Crohn's or my colitis or whatever it might be, then I don't have a whole lot of incentive to go buy the pills or the sprays or the inhalers that GW Pharmaceuticals comes up with. It will be in these corporations' best interest to lobby against medical marijuana laws and to lobby in the states that currently have medical marijuana laws to replace their whole plant cannabis with the Sativex, with whatever other drug they come up with. And this is, we are finding so much now. They mentioned the ulcerative colitis. We had the story in our headlines about the study showing that it may cause complete remission of Crohn's disease. And I was watching our show, Cannabis Cure UK, our Cannabis Cure TV, and Cannabis Cure, our friend Greg, who suffers from Crohn's disease, has just said that on his most recent episode, that he feels like he's in complete remission on his Crohn's disease. And I remember meeting this kid, getting off the plane from England after all he'd ever been able to smoke was swag. And he was a, tiny little guy, all, very skinny and pale and sickly looking. And within the 3-4 months he was here in the States, in Oregon, Washington, California, and Colorado, able to access good quality medical cannabis, we saw him put on weight. We saw him get healthier and healthier. And now that he's gained some status and some measure of, cannabis celebrity, he's been able to go back to England and still be able to manage to get a hold of some decent cannabis. And his symptoms are gone. This guy who suffered so much when he was out here has finally, after a regimen of about a year or two of good quality cannabis, beaten back his Crohn's disease. Do you think GW Pharmaceuticals want to hear stories like that? This is the Box Canyon that we have talked about many times on this show, and that is fighting only for medical marijuana. Pinning the legalization of marijuana on why you use it is ultimately a mistake. It's ultimately a mistake because as soon as you peg it to why you use it, you imply someone has the authority to judge your why. Is your excuse good enough? And we'll talk about this at the end of the show, too, in our Radical Rant with the Roger Christie story. Another example of using why as the reason why you deserve to use marijuana. In that case, religious sacrament. And you're going to find, if you listen to this show long enough, that we fight for your right to use cannabis for any reason. All use is none ya. It's none ya damn business why I use it. It's a plant. Nature or God put it here. And I'm not hurting anyone by using it, including myself. I'm healing myself by using it. No one has any right to judge that. No one has any right to stop us from using that natural plant. So it's a double-edged sword. We want the creation of cannabinoid pharmaceuticals. I mean, these might be good medicines for some people. This might be a better solution for someone to use a Sativex spray than to inhale off of weed or a vaporizer or something, but it's not for everyone. So it's okay to develop these cannabinoid pharmaceuticals, but always, always fight for our access to the whole plant. Speaking of access to the whole plant.
Indeed. I think that most of you know what that sound means. Time for a smoke break.
All right, we'll be right back. Stay tuned.
Oh, have you ever met that funny